in getting this hearing started. I want to thank my ranking member, Senator Sessions, all of our colleagues who are joining us here today, as well as the members of the public here or who are watching online. I also want to thank our witnesses for coming today. Dr. Len Nichols, he's the Director and Professor at the Center for Health Policy Research and Ethics and College of Health and Human Services at George Mason University. Dr. Kavita Patel, who is a Fellow and Managing Director at the Engelberg Center for Healthcare Reform at the Brookings Institution, and Dr. Joseph Antos, Wilson H. Taylor Scholar in Healthcare and Retirement Policy at the American Enterprise Institute. Thank you all for coming and joining us today for this very important conversation about health care costs in the United States and the implications recent cost trends have on our federal budget decisions. Almost 5 years now after the greatest economic crisis since the Great Depression, our economy is recovering, but far too slowly. Millions of workers are still looking for jobs. Millions of families are still worrying about staying in their homes or putting food on the table. We do have serious long-term deficit and debt challenges we need to tackle, since we certainly don't want to leave our children and grandchildren with an unmanageable pile of bills. And we have serious short, medium, and long-term economic challenges that we can't ignore. But there has been some good news recently. The Congressional Budget Office released its latest forecast, which gave us an updated view on our debt and deficit. This latest outlook shows we've made substantial progress when it comes to our short and medium-term deficits. It made clear that there is no short-term debt crisis, and the deficit reduction we have done in the last few years, combined with the growing economy, is making a difference. Recent trends in the health care sector have played an important role in this improved fiscal outlook. Medicare and Medicaid are two of the three largest federal budget items. So trends in health care costs have major implications for our nation's fiscal policy. Health care cost growth outpaces our economic growth, and it also grows at a faster rate than household incomes. The cost of health care affects every kitchen table and conference table conversation in the United States, as American households and American businesses face the question of how to pay for the health care coverage they want for their families and their employees. It remains a huge challenge for our businesses to stay competitive in a global market where their competitors have lower health care costs, and continues to limit economic growth by reducing the investments businesses and families can make, whether it's starting a new venture or buying a new car. But there has been some positive news on this front lately. Over the last several years, health care costs have grown slower than at any time in our history. CBO now projects the federal government will spend well over $500 billion less on Medicare through 2020 than it had predicted just a few years ago. The recently released Medicare Trustees Report showed an improvement in the trust fund, extending its solvency by 2 years until 2026 due to lower projected spending. And as the White House noted yesterday, consumer health care spending has increased this year consumer health care spending has increased this year at the lowest rate in 50 years. That's welcome news, and continuing these trends is going to be absolutely critical. There is an emerging consensus that the economic recession is not the only reason for the slowing of cost growth, which is also good news. There's evidence that structural changes in the way health care is delivered are underway and appear to be having an impact. And while the slowdown started before the Affordable Care Act was enacted, the law has set clear expectations for how health care will be financed and delivered in the future. And importantly, health insurance coverage is increasing at the same time and will continue to for the future. This is critical not only for families and communities, but also for our economy. Lower health care costs mean families and communities are getting care at a lower total cost to the system, and it means lower deficits and debt. By enacting comprehensive health care reform law, Congress took a critical step towards improving our health care system. And as I mentioned earlier, recent trends in the slowing of health care cost growth suggest we're moving in the right direction. But serious long-term challenges remain. Right now, Americans still spend far more per person on health care than any other nation. But spending more on care has not made us any healthier. Our current system focuses far too much on healing sick people instead of prevention and wellness. This isn't just bad for patients, it's bad for our economy. So we need to make sure we are moving towards a system where we prioritize prevention and quality. Fortunately, there are a number of reform ideas, many of which were included in the Affordable Care Act, that can help us address these problems and put us on track towards greater quality with lower costs. And the work that providers across the country, including my home state of Washington, are doing is making a difference. Accountable care organizations like the one run by Polyclinic and the one being launched by Providence Health, both in my home state of Washington, help ensure better communication between providers. Patient-centered medical homes, like the one run by Group Health in Seattle, aim to combine the personalized approach of a family doctor with innovative technology. And by creating fixed payments for all the care a patient is expected to need during a period of time, bundled payments could help incentivize coordination and efficiency between providers. These reforms will help us move towards a system where we are spending less on care and are healthier as a country. Increasing quality and encouraging efficiency and transparency is going to take all of us, providers, policymakers, and patients working together. But it is so important for the well-being of our families across the country, as well as for the long-term strength of our economy. Now more than ever, we need to be thoughtful about the reforms we are enacting and work together to ensure we're laying down a foundation for future growth and prosperity, both when it comes to enacting key health reforms and also when it comes to future budgetary policy. That is especially true when it comes to the complexities of health care and the consequences of decisions we make when it comes to the future of Medicaid and Medicare. We can't lower health care spending simply by shifting these costs from the federal government onto seniors and states and the most vulnerable families. Unfortunately, that is exactly what the approach the House Republicans took in their budget. If they had their way, seniors would immediately see an increase in what they pay for routine doctor's visits, the number of uninsured Americans would rise, and the most vulnerable families would be put at greater risk. That's not the right way to address our long-term challenges in health care spending. Now, Republicans claim that Democrats don't want to tackle health care costs. That's simply not true. We agree we need to address this significant part of our federal spending, but we believe we need to do so by coming together around a solution for real, lasting reform, not just by shifting costs and shifting risks. This is a complex issue, and we shouldn't have to wait until the last minute now to sit down at the table and try to find some common ground and work something out. And that's why now that the House has passed their budget and the Senate has passed ours, I truly hope we can move forward with going to conference and working together to solve these major, complex issues that are facing our country. As everyone in this room knows, we've tried many times now to go to conference. Every time we've been blocked. In fact, the latest threat coming from my colleagues, Senator Rubio and Lee, is that they want to actually defund health care reform, or they'll shut down the government. Well, I don't think that is a good solution, and we don't want anybody, including Tea Party Republicans, to push us into a crisis, because if they do, they're going to cut off health care coverage for 25 million people. They're going to end free preventive care for our seniors, and they're going to cause seniors to pay more for prescriptions. Those political games might play well with a particular base, but the reality is that not only is the Affordable Care Act already helping millions of Americans stay healthy and financially secure, but it is also helping slow health care cost growth. Instead of fighting what is now the law, I hope we could all be working together right now to make sure Obamacare is implemented in the best way possible for our families and businesses and communities. Continuing to manufacture crisis after crisis is only going to make the situation worse for our economy, whereas coming together to tackle these tough issues will help create jobs and keep America on its path to economic recovery. So I'm hopeful Republicans will join us at the table in a budget conference under regular order and work with me and other Democrats to address our long-term debt and deficit challenges as well as our long-term health care challenges. I just believe we owe it to the American people to come together around some solutions that help our economy grow, tackle our deficit and debt responsibly, and ensure we have a health care system that delivers high-quality, affordable care. So I'm very glad we're having this important discussion today. I look forward to hearing from all of our witnesses on this critical issue, and really appreciate your being here and all of our members being involved in this important discussion. With that, I will turn it over to my ranking member, Senator Sessions.